day everyone, my name is Richie V. Ramos Castillo, and for today's Unit CNE, we will be having a review of our hospital's restraint policy. Every institution has its own policy that serves as a course or method of action from among alternatives to guide and determine present and future decisions. King Saud Medical City's policy and procedures can be found on our KSMC portal, such as the Restraint policy. Our learning objectives are to be familiarized with the Restraint policy and procedures of King Saud Medical City, to know the different types of restraints, to understand what does the policy of restraints of King Saud Medical City all about and its scopes, to be able to apply restraints correctly as per KSMC policy, and to observe proper documentation of restraint monitoring on patients of KSMC. Before we proceed to our policy review, let us first define what restraint is, its type, and purpose. Restraint. It is the involuntary use of physical or mechanical device to limit or prevent movement of the whole or portion of the patient's body as means of controlling his or her physical activities. It can be used as reactively or proactively. As I have said, uses of restraints can be proactively or reactively. When we say reactively, it is the use of restraint in response to violence or to prevent harm. An example of it is restraining an agitated patient that can cause harm into his or her caregivers. While proactively is the use of restraint to support necessary treatment or when an assessment has indicated that an individual is likely to pose risk to self or others. An example of it is using restraints while doing a CT scan procedure on a pediatric patient. We have different types of restraints. We have physical restraints, which means any manual method, physical or mechanical device, material or equipment involuntarily or positioned adjacent to the patient's body that he or she cannot easily remove, that restricts freedom of movement or normal access to one's body. We also have the procedure-related protective immobilization, such as temporary use of an arm board during intravenous administration and body restraints during surgery. Protective devices, such as the temporary use of bed rails, tabletop chairs, lap belts, or tabletops for patients in chairs or those who are confused or at risk for falls. Mechanical restraints involves the use of equipment to restrain moving, like arranging furniture to restrict movement, bed rails, and mechanical locks. While the chemical restraint, a medication used to control behavior or restrict freedom of movement that is not a standard treatment for a patient's medical condition. And lastly, psychological restraints that can include constantly telling someone not to do something or depriving individuals of equipment or possessions which enable them to do what they want to do, like constantly telling a child that ghosts exist during night to prevent them from staying awake late at night. Here are the examples of restraint. This is an example of procedure-related protective immobilization. And for this one, we can see two types of restraints, the physical and the protective device, which is the side rails. We also have the chemical restraints such as the sedations and muscle relaxants that we usually use in ICUs and in ORs. Now, let's proceed to the policy. What does the KSMC policy stated on using restraints? Use restraint or seclusion only when it can be clinically justified or when warranted by patient behavior that threatens the physical safety of the patient, staff, or others. KSNC Hospital leadership staff shall oversee and determine and direct the hospital's approach to the use of restraints in the care of the patients. First, there should have a written order with clinical indication and any requirement for continued use and must be evaluated and documented every 12 hours. For adults, when placed in any mode of transportation like wheelchair or stretcher that will be needing a restraint, there shall be a written order with a validity of 12 hours and with indicated clinical purpose. Only registered nurse or midwives and competent healthcare providers shall be permitted to apply, release, and reapply or remove the restraints. All patients on restraints shall be considered at high risk for fall and should be monitored accordingly. Leg irons and handcuffs are custodial restraining devices used to restrain the prisoners unless the attending physician during routine treatment and admissions should be requested other devices which will not interfere with the treatment. Informed consent shall be obtained from the patient or her guardian or family by the physician after education have been provided prior to the application of restraint. People with developmental disabilities have the right to live in a restraint-free environment. Any decision to use restraint should be documented and reviewed through the monitoring process. All orders are time-limited and restraints must be discontinued at the earliest possible time regardless of the length of time indicated in the order. For chemical restraints, it should be indicated the patient name, medication name, dose, route, and that if it is stat or now order. Now, let's move on to the procedures. First, check the doctor's order. Second, explain the indication and procedure to the family or significant others to gain cooperation. Document the response on the patient or family education form and check the consent form. Third, assess the patient's skin integrity prior to the procedure, including the assessment of peripheral circulation. Fourth, ensure that the ankle and wrist restraints should not be applied on patients prone to have grand mal seizures and if skin or circulations are impaired. Next, check the patient's skin and circulation every hour for pressure points and maintain protective skin care. Release every 2 hours, alternately to allow freedom of movement and perform range of motion unless indicated. 6. Avoid constricting the patient by securing restraints to the bedside at a point where the patient cannot reach but where the nurse can release. Number 7. Reassess as indicated to determine if restraint shall be discontinued. Number 8. Ensure that the patient's privacy or modesty and dignity shall be maintained at all times. And lastly, document on the restraint monitoring sheet the procedure performed, assessment, and reassessment on the nurse's notes as deemed appropriate. This is an example of documentation of restraint that we can find on our Hospital Information System (WATIC). This form is called the Restraint Monitoring Checklist, and this is the step-by-step way on how to do the documentation. For your reference, you can find this policy in KSMC portal under MPP KSMC 155 version 7. And for further questions and inquiries, you can email me at p.castillo@ksmc.med.sa.